It's Mornings with Patti Arroyo.
Morning.
Good morning. On the radio this morning.
Right here on News Talk K57.
Baby. 9:35. We got Mike in the studio along with Phil in the studio. But I wanted to go back and revisit and update everybody on the story of the patient who was attacked with a knife that was lodged in his head. Yesterday I said, how do you get the knife out of somebody's eyeball? And certainly a team of people at the Guam Regional Medical City did it. We were in contact this morning with Dr. Weingarten, who wanted to update us. Quote, "Wow, patient eye still too swollen for thorough testing, but he can at least count fingers with the affected eye." So he's on the mend, which is a good news to hear, because yesterday they had a news conference with the team of doctors who were at the table to pull out this knife, and with the description by the Pacific News Center that they had to use a clamp, a mallet, and other things to... It sounds like they were building a small something on an operating table. Unconventional, it seems to me. I don't know much about that, but it seems like unconventional tools or medical instruments were used for this. On the phone with us now is Neurointerventional Radiologist, Dr. Scott Shay. Good morning, doctor. How are you?
I'm doing well, ma'am. Thank you.
Thank you for taking our call this morning. When you hear the description of what you guys did at that operating table to pull out, to remove that knife, and seeing the photo, it looked like you guys were building like a small model or something. When in fact these were the implements that were used, and a mallet and some clamps and vice clamps.
Right, so the procedure was actually performed in my neuroangiography suite, because the big concern would be bleeding in some of the vessels supplying the brain and face. So we did it actually in the OR-compatible angiography suite. The actual removal of the knife wasn't as simple as just pulling it out. Dr. Weingarten tried that technique, but it was well embedded in bone, and he was unable to pull the knife out. So a clamp device, this was kind of a jerry-rigged situation, but one of the OR scrub techs suggested putting a clamp on there and using a mallet and kind of hammering out the knife, and that's exactly what was done. It took probably 2.5 minutes total to remove the knife.
Wait, what do you use the mallet? What were you actually using the mallet to hit?
So the clamp was on there was a portion of the blade that was outside the face. Mm-hmm. So that clamp device was onto the blade that was above the face, and then a mallet was kind of applied to this clamp to exert a upward force on the knife slash clamp, if you will.
Wow.
Vice clamp. And that way the knife could come straight out. You don't want to rock it and try to pull it out, because then you can lacerate important blood vessels going to the brain. Immediately before and immediately after removal of the knife, I performed a brain angiogram looking at the vessels, because we're worried about bleeding that can be catastrophic and life-threatening. Mm-hmm. And in fact, there was one vessel that was damaged. It wasn't an important vessel, and I immediately after knife removal saw the damaged vessel and successfully plugged up the vessel. The medical term would be embolization. I plugged up the vessel so there was not going to be any bleeding. The ophthalmologist was in attendance, Dr. Jack. He did a quick evaluation of the eye. The patient was under general anesthesia, so we were limited, but he said the eye does not need to be emergently surgically removed. I'm happy to report that today, as you stated at the outset of this conversation, that the patient can see out of that left eye.
Amazing.
Count figures correctly.
Absolutely amazing. All of us saw that gruesome photo, and we all scratched our heads going, how do you remove something like that? And I got to ask you, is this sort of unprecedented in your field, or have you seen these kind of violent injuries?
Very, very rarely. I mean, and this was the worst situation that I've ever seen.
Wow.
We also had an ENT doc because the knife went through the left orbit, crossed the midline through the sinuses. There's some sinuses, paranasal sinuses, and then it actually crossed over to the right side and pierced into the intracranial fossa, into the brain cavity, if you will. So we had an ENT physician in attendance who did some packing of the nose because, again, we weren't sure if there's going to be significant bleeding. So it was definitely a team approach with neurosurgery, ophthalmology, otolaryngology, a.k.a. ENT. Of course, we also had an anesthesiologist in the room because this was all done under general anesthesia.
But it's interesting. The Pacific News Center the other day was saying how the victim was able to speak through a lot of what was happening to him when he was first taken in. I guess during triage, he was able to speak. So that it has no effect on his brain or any of his other functions?
Right. No, he was extubated. He was taken off the breathing machine on post-op day 1 yesterday morning. I was actually in the ICU room when they removed and he's talking, he's conversant, he's moving all extreme. There's no evidence of stroke. There's no evidence of any neurologic injury, and now he can actually see out of his left eye. We can't. It's still too swollen. We have to kind of open it gingerly, but he can count fingers. We don't know what his visual acuity is. That can be assessed in a week and a half by the ophthalmologist. The good news is the eyeball will not have to be surgically removed, and he does have a visual sensation preserved.
So how are you going to apply this procedure to your practice down the line? I mean, is this going to go in some kind of annals or some kind of publication?
Well, that's a good question. Very good question, ma'am. And when you have a very unusual case, surgical journals are always looking for what we call case reports. And it can help other people in other parts of the world on how to do something like this. So this will probably we'll write this up as a case report and present it in the Interventional Neuroradiology Journal as well as a neurosurgery journal.
Well, and now here we go with this third eye with this tech that was in the operating room. He's a local boy. It sounds like he's got a local name, Brian Fergerger. Is he a local man?
He's a local gentleman.
Mm-hmm.
I work in the angiography suite, being a neurointerventional surgeon, so I don't know him personally, but he was an invaluable member, and he's one of the well-respected members of the OR team.
I guess so. He's your new best friend on how to remove something like this. Boy must have grown up on a ranch somewhere and took watching his uncle tinker with the refrigerator or something like that.
Exactly.
That's some brilliant stuff. You think that now that it's all said and done, you look at it and go, I thought if I had a couple more minutes, I probably would have thought of that.
Yeah, well, my job was to do the angiogram and assess possible bleeding risk before the procedure and then take care of any bleeding after the procedure. So Dr. Weingarten was tasked with actually explanting this knife.
Yeah.
Well, and I think he, being a very team player type of physician, during the pre-op chalk talk, he was talking to the team and saying, any suggestions on if we can't pull it out, because oftentimes
you gotta wiggle it,
embedded in the bone.
Yeah.
So it's nice to have that pre-operative, I call it a chalk talk, like a basketball coach before the game, you sit there and so the chalk talk was invaluable because a key member of the team came up with an idea that worked.
Brian, he's our man. I guess we're going to have to try to find him and talk to him about where he gets his experience.
Absolutely.
Pretty interesting stuff. Dr. Shay, it's a pleasure talking to you. It's a pleasure meeting to you. It's nice to know we have this caliber of physicians up at GRMC. Although I'm not hoping that anybody would get stabbed in the eye anytime soon, so that we could test your knowledge a second time around.
No.
Well done on your first go at that. Appreciate your time today, Doc.
You're very welcome, ma'am. Anytime.
All right. Have a wonderful day.
You too, ma'am.
Okay.